And thank you so much, Ro. Good afternoon, everyone. Thank you for joining us. We still have some people joining, but we do want to kick off today. So thank you for joining the Grand Families and Kinship Support Network and the Child Welfare Playbook, who is co-hosting our learning community on kin mobilization. I think this is session number 6. If you received this invite from someone else and you want to be added to our list, please send me a chat with your name and email address, and we will get you signed up. Also, I am going to put in the chat the kin finding toolkit that Marina Nitsa and her team put together, which covers all the different strategies that we're discussing in each of these sessions. But the good thing about these learning community sessions is that we have people who are actually incorporating and implementing these strategies. And so it's a great time for you to ask questions or even to share your own experiences with us in the chat, or you can raise your hand and speak to the group. Because we do want this to be interactive also, and we'd love to hear what you're doing that is working, or even some of the challenges that you're having with trying to implement some of these strategies. And I will also put some information about our website in the chat for the Grand Families and Kinship Support Network. For those of you who are not familiar with us, we are the first and only National Technical Assistance Center on Grand Families and Kinship Families, and we are here to provide support to you and your colleagues in providing better services and supports for kinship and grand families around the country. So please go to our website. You can fill out our request form for assistance, and we'd be happy to help you, not just on family.
Meeting ID followed by pound.
Hold on, not just on kin finding, but other areas in supporting kinship families. So let me then turn this over
Enter your participant ID.
Hold on, let me find this person and mute them. But Marina, do you have anything you want to say?
There are more than 70 participants.
There we go. We got him. Hey, everybody.
Good. Sorry, I couldn't talk and click at the same time.
That's okay.
Marina.
Go ahead.
Take it away.
Okay. Thanks, everybody. Welcome to today's session. I'd love to pass it to start off with, rather than going slides back and forth, to Shannon from Connect Ohio, who's going to present on chosen affirming family finding. And then I will talk a bit about some methods from different states around using the Snowball method or the gentle commitment escalation method for helping engage kin when we find them. But Shannon, I would love to pass it to you.
Wonderful. Thank you, Marina. And thank you, everyone, for, I'm going to share my screen. Hopefully, nope, that's not the right one, for having me here today. I also want to let everyone know that Christy Burry is in the audience somewhere as well. She is Connect's Director of Strategy, and I will be leaning on her if I've missed anything in the presentation that she knows that you might want to hear and or has questions, and I'm going to help answer questions. I'm very excited to be here. I will try to do a slideshow so that you, and I'm not the most, there we go. Okay, so I can see Marina and Melissa, so you're going to be my person to say I'm doing it. So I'm not going to read to you about Connect. I think last month you may have had someone from Connect share the Connect to Family programs, but I didn't get to be with you. I do want to introduce myself. I am Shannon Deinhardt. I'm the co-founder and the executive director here. We're in Ohio, and I'm a social worker by background, so I have a lot of practice experience working a long time ago with young people who needed adoptive families. So assessing families, working with young people to move them into their new adoptive families. When we founded Connect, we began to transition our work and are now really working with our state and others nationally on how we think about kin first, and helping organizations, both public and private, build a kin first culture. Ohio is a county-based, a county administered system. So when I talk about chosen affirming family today, we did do that in partnership with the county. So we have 88 counties here, and Cuyahoga is one of our largest. So we have 3 metros. But anyway, our approach has been to do this work with anyone here in Ohio and those nationally who are working to build our kin first cultures. And how do we do that with kids in foster care, kids in congregate care, And I'll talk a little bit today about our Chosen Affirming Family program. This is just a host of our programs that we operate here in Ohio, and as we begin to look to support others nationally. I wanted to just share, though, quickly, something that's important in all of our work is that all of our programs, no matter who they're serving, have shared values. And so as we've learned how to implement our programs with our partners, we use implementation science. Understanding assumptions and values has always been our first step in our implementation, because if those values aren't shared, it's hard to implement programs. So I will go ahead and just get to what I know everyone's most interested in learning about is how do we do family finding, or how did we learn how to do some family finding with young people who identify as LGBTQ+. And that's our Chosen Affirming Family model. I'll give you a little history, and I'll leave these values up there so that you can review them, because that's how we had to start. This was a Quality Improvement Center grant that Cleveland was awarded, and we were subcontracted to work with them on finding permanency. So getting young people out of foster care and back to family who identified as LGBTQ+. But we also had the opportunity, as we began to build out our model, to work in the Youth Acceptance Project, which could be another webinar for another day, which is for kids who are at risk of leaving their families because of their diverse SOGI. So I'll use the word SOGI a lot, and I'll just define that for you. For anybody, always please ask questions in the chat if there's something I say that you would like some explanation around, but it's a sexual orientation, gender identity, and expression. So I'll use LGBTQ+ as well as diverse SOGI a bit interchangeably throughout our time today. So these were the values that we all agreed on as a team, with Cuyahoga County as our partner, Cuyahoga County who had custody and who had the obligation to safely identify the young people that we would then be serving. So just to sort of give you a sense of our working relationship. I'm going to give you a very fast overview. I'm sure this is very well known to people that are on this call who've worked in child welfare or with families. Is what we know about LGBTQ+ young people is the victimization that they often experience, rejection from their families and or from foster caregivers. They often may run away, experience homelessness. So sometimes these young people might come into juvenile justice looking like a truant and delinquent, but really that's just a symptom of the rejection that they may be experiencing in their lives, and often experiencing physical and mental health disparities as it relates to their status and the rejection that they experience from our society and community, and then the isolation. I want to point out to the 30% of youth in child welfare that identify, because right now there's only been 2 studies. One happened in LA with the RISE project, and we were fortunate enough to have that replicated here in Cuyahoga County. And what that means is when the Quality Improvement Center reached out to our young people in foster care and asked questions, 30% of them identified that they identified as LGBTQ+. When we started our program, we asked the social workers or the caseworkers at Cuyahoga County if they knew if they had any LGBTQ+ young people that they were working with, and that number was 2%. When we implemented the program, we asked them about that, and we had 2 answers. Social caseworkers who said, well, I don't know, I guessed, and others who said, I know, I knew, and I wouldn't tell you. So it spoke to the safety and the culture that has to be established to implement this kind of work. So Cuyahoga County did a lot of work and a lot of training of their staff over the time that we were together. We worked together. About 2 years ago, they did that same desk survey, is what we called it, and they got to 15%. So part of their work was also making sure that all caseworkers, when they met their young people, were asking about their SOGI status. I say, though, they know that's 30%, so there's still more work to do. And again, in order to help decrease these statistics that we see, that Young people who identify are 8 times more likely to commit suicide, have higher levels of depression, and all of these outcomes that I suspect are not something that you wouldn't be aware of. So they are young people who with diverse OG are disproportionately experiencing health challenges. They're more likely to come into the child welfare system, more likely to have placements in foster care and end up in group care, and often not end up reunifying. And we'll talk a little bit about how the chosen affirming family helped to do that. So we know that this is what they need. Young people need accepting and affirming families. Caitlin Ryan, who's the model author of the Family Acceptance Project, did this research to help us understand that. When young people are in accepting what they can believe about their lives. So the goals of the Chosen Affirming Family Program was to increase acceptance and reduce or decrease rejection for young people with diverse OG, increase their overall physical and emotional mental health and well-being, and increase their supports and the family's supports to LGBTQ plus resources, develop networks of affirming people for them, and hopefully legal permanency. So that was our goal for the kids that were in foster care. For our systems and our communities, it was to create more collaborative partnerships so that they could also support young people and their families, and that child serving systems could align with the values of the program. And so we did a lot of training with our community partners as well as with Cuyahoga. So some of the practice elements, and then I'll talk a little bit about the work, was that we did a roadmap for families. We did that for both our youth acceptance and our chosen affirming family and for our caregivers. And then our roadmap for our systems was that they would have CAF, that they would have they'd have training and safe identification. We did develop a SOGI 101 and 102. And then we did a cultural adaptation to our family finding model as part of chosen family. So what did we do? I'm going to see. I'm going to just talk about the model while you look at what our outcomes were. Our family specialists were assigned young people, and they implemented, they used technology. They first spoke with the young person. So let me start there. When we do chosen affirming family, sometimes different than family finding, we are working very closely with the young person about who they know, who they don't know, who they want to be connected with, who knows about their SOGI status, and how they want to talk about that. It was always by consent as well, that we worked with young people. Nobody had to work with us, but as many youth in foster care know, they want to leave to families or to people. They don't want to age out to homelessness. So we had no problem. Like, people wanted to work with us, but where the SOGI competency came in was a little bit of that nuance to just traditional family finding. So we worked with the youth in whatever way they were ready. Some youth had already established relationships, so it was just finding them, getting them to come to the table. We had meetings, so that was an adaptation to the model where we included network meetings, and then building out the plan for what the young person needed and wanted from all of the family. And for the young people who did not know, who had been in foster care for a number of years, we had to do family finding, built genograms for them. We did, if any of you are familiar with mobility mapping, is a nice tool you can use. We use that tool as well with some of our youth to help them remember. And then it was reaching out and then bringing those family members. And again, other chosen family. There were lots of people in these young people's lives that they wanted to be connected to. So we served 33 young people with 23 caregivers. And then the YAP families were separate. And what we have now is an implementation manual, an intervention manual. We have a training series and policies and procedures for safe identification for the public child welfare system, because that's critical to being able to serve the youth, is that They know how to identify them. They know how to collect that data in a safe way. I know we're all from different parts of the country. And Ohio we have a lot of legislation now that is not in support of trans or LGBT plus young people and their families. So that's your first line is to understand what that looks like in your state and in your community. So this is just a little bit about our data. And 30% is pretty high. That we have 3,000 kids in foster care in Cleveland alone. So there's a lot of young people that identify and may not be getting the supports and resources that they need. All right. This is how we do it. We train. We train specialists to do the work. So we don't do the work. We want partners, agencies, private agencies to do the work, embedded into their culture and whatever fits within their community. And then we provide the technical assistance, the coaching, and then the evaluation support. So that's how Connect has modeled our programs. And that's how we've modeled the children affirming family work that we do. So our metrics are that we have increased placements with kinship caregivers, permanency, and well-being. And then for caseworkers, it's just that they have an increased understanding of what it means to be LGBTQ young, to be an LGBTQ young person and what they need and how they can better support them, as well as what it looks like if a young person's in foster care, ensuring their safety and that with that foster family. I know it was pretty quick. I know Marina was going to give me 30 minutes, but I felt like there might be a lot of questions. And I didn't want to do all of the talking. I'm going to leave this one up for a little bit so or I can put it in the chat and then I can end the slideshow. Before, Marina, I let you say anything. Christy, I know you're in the audience. Is there anything you would add to what I've shared today?
Hello, everyone. No, I think that the questions could generate some further discussion. Just to reiterate that we have moved forward and we talked a lot about the project, but we have created training curriculum for implementing our CAF model, as well as a safe identification training that really then gets at working with leadership within an organization, focusing on creating champions with an organization that are affirming, and gets at policies and procedures that create an affirming environment for staff to be able to do this work, because we know a lot of times those barriers are in place, those structure barriers and systemic barriers are in place to do the good work. So there are those trainings, and this is about implementing this work in the context of general family search and engagement work and other kinship caregivers, and then also adapting our Connect to Family program, which is an adaptation of 30 Days to Family. And so ensuring ways that we're finding ways to incorporate the two models together, the two approaches together, from a training and learning and development, but then also as part of our implementation support and planning revolving around programmatic work that's happening within a site that we can incorporate this. So just wanted to mention that.
Thank you.
Yeah, I'd encourage anyone with questions, feel free to drop it in the chat, or you could come off mute and ask. I think this is such a powerful program with amazing outcomes that we could really be replicating everywhere. While maybe other folks think about their questions, I will ask you one. You talked about the youth using mobility mapping to think about where they've been and what connections they may have had that perhaps they've fallen out of touch with. And often youth are shy or reticent to reach back out to someone. Do you have any techniques that have worked there for helping connect youth back to their kin that they've maybe been out of touch with?
Mm-hmm. Yeah, actually, we in addition to our CAF model, we support the implementation of youth-centered permanency roundtable model, which is the Casey Family Program model that we help support our state in. And so we developed a youth preparation. So yeah, so we talk, I mean, I think everybody on the call probably has, I sometimes think about young people as some who've been in foster care a really long time may know no one. They may really be disconnected. And so yes, then how do you work with them to begin to help them understand that they do have family out there? Then there's sort of the middle of the road. They know some, but maybe those people are still struggling and they need to know more. And so how do we talk with them about being connected to their family, no matter who they are, and then how do we help them build build with them, and then those who know everybody. So I think it's that, and then there's the repair work. So some of the older youth may have had some challenges and want help on how to reach back out, and we are happy that we support them in that before, during, and after. And so a good question came up as we were building this model with our family finding with our youth navigator network is, that if a family member doesn't want to be connected, what is that going to be like? So we talk through all of those scenarios. Some kids who aren't out to anybody, we're talking through then, what is this going to mean if you're not ready to tell, but you make a connection? And then when you're ready to disclose, how do we support you? And could that look like? So that's absolutely part of it.
Yeah. Shelley, you had a question. Do you mind popping off mute maybe and asking?
Yes, I do not mind popping off mute. Hello. Thank you so much for this presentation and this important work. I'm just curious to hear you talking about what barriers you might see to this work coming up right now and in the near future. I know it's a really interesting time to be doing this kind of work with diverse SOGI youth. So could you talk a little bit about how you see that in the near future?
And I'm going to also let Christy from her government experience. I mean, this is do no harm, and we have a responsibility in child welfare and child protection to do no harm. And so that has been the frame of how we train it, how we do the work. And I think a leadership's commitment to the work is critical, because if you don't have your leadership's commitment, it would go sideways. So, we have leaders across our state in public child welfare that are not committed to this work, so we would not be doing this work with them yet. So for me, I mean, I think the barriers are that this has become a political issue. This is not a political issue. This is an issue about well-being and safety and permanency, and that's what all young people deserve, and that's what we promise them when we become involved. So, I don't know, Christy, do you want to add to that, or even Marina? I think that's it.
Making it about young people and families and what their diverse needs are, no matter what that looks like, whether it's behavioral health needs or, we have an obligation to meet families and young people where they're at, to make sure that we're individualizing our services and our approach and the way in which we engage and considerations. And so I think that's really important as we talk about this work, and always thinking about it in that context because of the political landscape. I know that the work that has to happen with leadership is so important, because oftentimes it's an acceptance of wanting to bring training to our organization so that we know that they are informed and that they are using, they're able to develop deeper relationships with those that they're serving. But sometimes their thinking about this work stops at training. And this really gets at it being so much more. So that safe identification work and the leadership work and the buy-in has to be done first before you just start, because otherwise we're setting up social workers and other professionals for failure. So I was just pulling this up too. Like when we think about policies and procedures, like is there a commitment to have a non-discrimination policy to include diverse SOGI? How are we updating social media and communication policies? What are we all agreeing in with how we document things with permission? When you start talking about these things, other than just training, staff that are doing direct service and making those decisions, these are the things that we often miss, and then where we run into those barriers. So I think that's an implementation science approach that includes a lot of time and effort in that initial exploration phase, and thinking about installation beyond just training those that are doing direct service is a huge aspect of this work that has to be there.
Have you guys developed any resources, or even if it's tactics, that help guide youth who are maybe trying to reach out and build bridges with kin who are willing to be accepting but don't feel like they have the terminology or the knowledge to fully be as accepting as what the child needs?
Yes, I mean, so part of our work, and I did plug in the National SOGI Center, is also a great resource. And so we had the resources of our other sites who were doing a bit of different work in this space. But yes, I mean, I think that is critical. A lot of young people live with foster families or kinship caregivers who are accepting, but not necessarily affirming. And so having those conversations and so examples of that, to be really concrete, is I may be able to dress as the gender I identify with at home, but not at school. Or I may be able to dress as the gender I believe I am, but not when certain people are, right? So those young people will say they feel accepted. You and I may say they are not being affirmed because they're not allowed to be who they are all the time. And so those are important conversations, and important, again, about how we work with young people, not for them, and how we meet them where they're at. And so, yes, I mean, we use all of our community resources and all of our partners to help when we were working with young people in that space to do just what you've described. And I think that's critical to have those partnerships as well. And yeah, that's a great
Makes
question.
sense. Felicia had asked for some data in the chat, which I believe you linked. So, and then Felicia was wondering, are there any evidence-based information available for how to utilize mobility mapping with CPS staff, families, and youth?
I don't believe I know of any evidence-based yet. So, and I was just on a call before this about the designated role placement that's going to be coming. And so there's also not a lot of evidence-based programs in the LGBT plus space. So that was some of the conversation we were having as well.
Makes sense. Any other questions for Shannon and Christy? And they have very generously provided their email. So if you think of one later,
yep, absolutely,
you can message them here. Melissa, you can ask. Yeah.
Yeah, so I don't know if there's an answer on this, but I'm just wondering, have you found that there are any certain traditional kin finding strategies that don't really work very well with LGBTQ plus youth, connecting those youth to kin?
That's a good question. I'm going to just sort of go back in my mind about our work. And then Christy, if you think of anything, I will share anecdotally for the young people who had been in care for a long time and then they came out in foster care. When we did their family finding, it felt very traditional in that the families were often so happy to find their young person who they thought, was with the mom or had been adopted. There had been things they'd been told. And so, at the appropriate times when we would share, or the young person would share, because again, they were a part of those efforts. There wasn't a lot of rejection. They would often talk about other members of their family, and that this wasn't an issue, and they were just really grateful to have this young person back in their life, and how could they get involved and how could they help. So, but clearly we were still providing resources and giving them support. So no, I can't think of any of the strategies that we've used that weren't harmful. It's just more of how do we make sure that the young person is working right alongside us, that we're working alongside them as we reach out to family members. Christy, is there anything from?
I mean, I would just, what comes to mind when I think about that is what is harmful is us not being grounded in this work, because sometimes, even with our own program, traditional strategies, family search and engagement strategies, and outreach and engagement and support planning that we do with caregivers, in whether it's 30 Day to Family, whether it was our program, whether it's WWK, and so I'm just picking some programs for example. Oftentimes when it's child-centered recruitment, then the focus is, finding them family. And we can't only do the affirming work that in our partnering with the young person, it has to be affirming work that you're doing from the very beginning, that the young person is guiding, whether they're okay with disclosing, whether they don't want the people. So it's such an important aspect. And the harm comes with when we begin working with young people, or training, and so that we are asking questions and we're developing those relationships, but then that goes out of sight, out of mind once we're looking for people. And there's a right way to do that and a wrong way to do that. And so it's becoming more and more difficult for me to think about doing family finding work without integrating all of this into the work that we're doing with the young person, and then every aspect of the work that we're doing, not just in engaging them, but what are we assessing and how are we assessing whether a young person has made a decision or not that they want anyone else to know. So what are we thinking about? What are we looking for? So those are just a couple of things that come to mind, because it's not that the family search and engagement and family finding work is harmful in and of itself, but it can be harmful, absolutely, if there's gaps in the knowledge that we have or the steps that we've taken to be as informed as possible in implementing those family finding strategies.
Thanks.
Any other questions for these two on this topic? And if not, they have, again, very generously shared their emails, and we'll share that in the after meeting notes. And it sounds like this is a topic for the whole country to keep working, learning from you, but definitely work hard on. And Christy, what a great point. And I'm noting it for my team members on this call too, of helping really think through, as we're reaching out to someone, using, a name that doesn't reveal, right? If perhaps the child is going by a different name than they were before, maybe that's okay. Maybe we definitely want to use that name because it's affirming, or maybe we don't because we aren't ready to reveal to a particular family member. And that can get, I imagine, tricky really fast, especially with our really creaky old child welfare IT system.
I know. I do a lot of training and consulting in the DV space too, so it correlates. So sometimes our very present, our intervention or our work that might be best practice, it might be all of the things, but if our very involvement or outreach can be very harmful and damaging if we're not kind of trained and skilled in our assessment and our engagement and interviewing and in our documentation and our service planning or case planning. So there's a parallel that I often think about.
Absolutely. Well, thank you both so much for coming and presenting today. For everyone here, this is recorded, so you'll be able to share it with your colleagues. And again, we really, really, really appreciate your insights and this work. So I will now switch gears a little bit to talk about when you do find those kin, how with the youth ideally, or perhaps the child is much younger and you're finding them in a different capacity. This is a tactic that I first learned when I was visiting Uplift Human Services in San Jose, California, where I was meeting with the placement desk and they were sharing a story that has really stuck with me, which was they often would call, potential kin that had been identified on behalf of a child. And their first question was, well, can you take placement of this child? And that kin, as we heard earlier, may have thought that child was adopted, may have thought that child was with their parent. They may have thought that child was safe and fine, and is now has a lot of feelings that are happening in a 5 or 10 second span. And to jump right into, or potentially they didn't know the child existed, and to jump right into, but could you take placement of them potentially forever? It's so overwhelming that many kin therefore disengaged. They didn't call back, or they hung up, or they said, call me back later, and engagement didn't go. So he tried a new tactic that worked a lot better, which was when he called the kin, he asked them if they had a family photograph to share with the child. So he tried to think of what was sort of the smallest approachable engagement, which wasn't even necessarily an interaction, right? It was, could you forward a family photo that we could share with this child or make sure is in their file? And he found that was the level of engagement that was all overwhelmingly people responded to. And so that is what led to collecting a number of other tactics in the playbook around this, which we go by two different terms. One is the snowball method, this is actually traditionally a way to pay down debt, where you pick your smallest debt and then you pay it off, and then you pick your next debt, and it sort of rolls into a bigger and bigger snowball. So the idea is you ask for a photograph, then maybe there is an exchange of a letter, and maybe there's a text message, and maybe there's a video chat, and maybe you commit to helping a teenager learn how to tie their tie for prom, and then that snowballs into a greater and greater relationship, and a different way that we refer to it as gentle commitment escalation. So again, not coming out with, can you be a full-time caregiver forever and ever for this youth? It could be something small, and then maybe that commitment will grow in time. And this can apply to all kin and all relationships. So a few tools I'd love to share, and everyone that we're showing today regrets not being able to make it today, so I'm going to pretend to play them on TV. But I just want to give a few examples to think about using in your agency or jurisdiction to help with this idea of the snowball method or gentle commitment escalation as you're engaging kin. So we are probably all familiar that we are legally required to send out notices to all kin when a child has been in foster care for 30 days. I have a little bit of a pet peeve about some of those notices because they tend to be quite scary and legalese. And I think there's some room for improvement there, which stay tuned. We have some ideas about later on this year. But as one example here, Hawaii really leaned into using that opportunity to say, hey, how can we get the kin that we are notifying to engage with this youth in some way that does not have to be placement, right? So as you can see here from the form, they have all sorts of different options that a relative can check, and the checking sort of makes it as easy as possible to take one step in the direction, because they're ideally already submitting this form to say okay, we've received it, we acknowledge that you sent us this form, and yeah, we'd be willing to exchange letters, do a visit, or maybe something even smaller like providing family medical history. Maybe I'm not ready to engage yet, but I'd be willing to share that grandma had heart disease. Maybe I'd be willing to share photos. Maybe I'd be willing to do a family visit. And so I thought this was one example to consider that you could add in as you are thinking about what your initial outreach strategy is, whether it's letters, whether it's a phone call, et cetera. But are there smaller opportunities that you could give to those kin? And then you think about it, now you've got potentially 7 different connections, when if we only reach out about placement, we run the risk of losing all those 7 connections. Maybe they aren't available as a placement. Maybe it's overwhelming, whatever it may be. But if we can get each person on a smaller commitment, we don't know where those relationships may lead. Similarly, Michigan has developed a relative response form that encourages responding with some level of commitment, providing medical family history again, a visit, providing transportation back and forth to school or back and forth to visits. That can be something, as we all know, can be extremely difficult for our social workers to provide. Not everybody has hop, skip, drive or the equivalent. And so maybe if you can find those kin that were willing to drive once a month or once a week, maybe that kiddo, that means they can go to soccer practice or they can see their friends or whatever. It can restore a little bit of normalcy. And then they have that relationship in the course of that weekly or monthly or infrequent car ride. And then also holidays are a great opportunity that can loop kids in with their kin, especially if there's been a long period of time of disconnect. So Michigan's form is another example here. And then this has come up in a few other contexts, but I think they're really, really excellent tools for when you're having those conversations. And this is from GPL, Harvard Kennedy School's Government Performance Lab, and we've got a link to it with a guide defining and engaging relative and non-relative, as in other kin caregivers. And they have different questions and answers, like, I just can't deal with, mom anymore. I'd be happy to be a support in some way for this kiddo, but I just can't deal with their parent. That's one objection that we hear. There's too much on their plate. Okay, we hear that. What kind of commitment it might be possible to keep this kiddo in your life or to establish or reestablish a connection to them that works for that child and what they need, and it still works for that adult, because kids in care or not in care, all kids cannot possibly have too many adults that love them and are involved and engaged. So this guide is really great. Again, it's got a lot of the common objections that folks will raise or common concerns folks will raise with some recommended answers. And as you're building out training programs for your office, as you're rethinking what your kin engagement strategy may be, some combination of offering these snowball method and gentle commitment escalation options, plus being prepared to kind of handle what those objections and concerns may be, and really being centered on the child, which is the whole theme of all of this collaborative, can really help not scare them off and get them engaged in whatever way makes sense. Any questions broadly? It could be back for Christy or Shannon, or it could be on anything else we've talked about today. And as a reminder, we are all here to give you technical assistance. And so I'm sure Melissa or Ro will drop in the chat if you need help implementing any of these, if you're updating your training, if you're rethinking about your ASFL kin notification letter, we would love to help. If you have a quick question, if you want more technical assistance, reach out. I think, Melissa, you built a really amazing network of SMEs that can help whatever your question is. Vanessa wants to know if the presentation can be emailed to us. Shannon and Christy, could we include your presentation in the after meeting notes? Great. Okay. Yes, Vanessa, we will get that to you. Thank you, Kylie. Kylie just dropped in the link for if you would like to request technical assistance, big or small. It could be a question. It could be help with a project. Would love to match you up with the right SME to help. Any other questions, concerns, comments on the topics we covered today? If not, we're always happy to give you a few minutes back at some of these sessions.
I just have a quick comment. This is Patrick
Please.
Pisani from the Institute in St. Louis, Missouri. And
Hey.
we oversee the replication of 30 Days to Family, as Shannon mentioned earlier. And I just think the snowball method is just really, really powerful. And I think what we've seen around the country in our replication efforts is a lot of agencies really seem to have kind of the placement component taken care of, at least to some degree. But it kind of has become sort of like a all or nothing sort of practice in terms of family involvement. Like we'll put in all these efforts to get that kid placed with family while not kind of maintaining those connections and the relational aspects of that child's normalcy and well-being, and that even kids that have to remain in traditional foster care deserve to have that robust network of supports around them. And we spend a lot of time coaching to try to inform relatives that they can be involved in so many other ways beyond just placement. And so I just wanted to make a comment that that's so applicable, and so such a powerful message for us to all keep in mind. I often like to think of our program as more of a family connections model, that, hey, placement is one of the great outcomes that comes from that, but not kind of like centralizing the placement first and foremost can be helpful. So.
Yeah, I love that framing. We are totally on board. It's why this is the kin mobilization series and not the kin finding series. Felicia asked if we could share the hyperlink for the guide. Yes, absolutely. We'll include that in the notes that are sent out after the meeting. For those of you that haven't read the Think of Us report, away from home. But one of the key findings that really stuck with me from that was that most youth leave foster care with fewer connections than they came in with. And that does not have to be the case, right? Because we do not do a great job collectively as a nation of capturing those kin that are there and then helping keep them connected throughout it. And I think this is one of many approaches that help with that, is making sure everybody's got a role. And if somebody is not currently looped in that is kin, that we, loop them in sooner rather than later. And we help that youth, even if it's in years, even if the youth worries that they hurt the relationship in some way. Or something I've experienced is sometimes the kin are afraid because they're like, hey, I didn't show up in time, or I have a sense of guilt now. And really making it safe for them to step forward and being like, the best time to plant a tree was 30 years ago, but the next best time is today. So don't stay away from this kiddo because you have a sense of guilt that you weren't here sooner.
That's so important. And Patrick, I was going to add on, when I agree with you so much with what you said, and it made me think too about the comment earlier about what other supports does the family. So like the people that we're reaching out to, what they need ongoing support, not just that we, in the beginning, but like what are the ongoing needs that they may have, whether it was in the affirming context, like they, and so your kind of point is so important as it relates to the young person, and then everyone else that we're bringing into their, into the picture. These are such good talks.
We hope everyone is finding them useful and finding the recordings useful, because maybe this isn't a thing you're working on this year, but it is next year. We really hope that this could help capture some of that. So we build a reference library to complement the kin finding toolkit, which, Melissa, we probably need to rename to the kin mobilization toolkit, but
we can do that.
Great. Yeah. Any other questions or comments for today?
I just want to mention the next.
Please.
Oh, I'm sorry. The next session is going to be on August 29th at the same time. And if you are not receiving these invites, I'll stay on for a minute. You can put your name in the, send me your name and email address in the chat, and I'll make sure you get added. Anybody else? Anything else to add? Thank you so much, Marina, Christy, Shannon, and everyone else who joined us today. A great afternoon.